So welcome everyone. It is great to see you all, and we're excited about this conversation today. We want to make sure that everyone has a chance to really participate in the conversation. So as usual, when we do these, please make sure that you put your comments, questions in the if you're watching on Facebook, in the chat on Facebook. We'll be getting those questions. We can ask them of our experts and the families that you'll hear from today. We're excited about this conversation. I'm Stacy Stewart, President and CEO of the March of Dimes, and this is another series of Healthy Moms, Strong Babies webinars that we've been doing for almost 2 years now. Very soon will be 2 years, bringing a range of different topics, bringing a lot of experts together to talk about different topics that I think are of great interest to a lot of our supporters and just people in general, and hopefully many of you. Today, obviously, the conversation is around birth defects. We're kicking off 2022 with our National Birth Defects Awareness Month. We're really thrilled to be partnering with CDC on this particular conversation today. So thank you to CDC for the partnership that we've had for any number of years to raise awareness around birth defects, to help provide information to many families whose babies may be affected by birth defects, and support any ways to improve the health of all families, moms, and babies, and certainly raise awareness around how to prevent birth defects, which is ultimately our goal. In many countries, including in the US, birth defects are the leading cause of death for many infants, for young children. About 1 in every 33 babies born in the US today is born with a birth defect, and that's according to the CDC. And as our nation is continuing to struggle through a COVID-19 pandemic, and obviously the rest of the world as well, having a plan that you and your family can follow is now more important than ever to keep babies as safe as possible. If you or anyone that you know is planning to become pregnant this year, now is the perfect time to be preparing. And so part of what we want to do is share information that you might be needing to think about as you're preparing to become pregnant, so that you can minimize the risk of birth defect if at all possible. Before we kick it off, I want to define what we're sort of talking about today. Birth defects are structural issues that affect one or more parts of the body, like a baby's heart, brain, or foot. They most often develop during the first 3 months of pregnancy, when a baby's organs are forming. Birth defects can cause problems for a baby's overall health, how the body develops and functions. There are common birth defects that include congenital heart defects, cleft lip and palate, and spina bifida. Genetics, behaviors, and social and environmental factors can impact the risk of birth defects. And what we know is that not all birth defects can actually be prevented. March of Dimes is proud to be a part of a movement raising awareness and action for more prevention and more research and care for babies affected by birth defects. We also work with states to ensure they're testing babies for health conditions. This is really important. The testing of certain health conditions at the time of birth are recommended by the Department of Health and Human Services at anywhere from 1 to 2 days of life, the first few hours of life. March of Dimes advocates for all babies in all states to receive newborn screening for at least 35 health conditions in the first few days of life, as many of these health conditions can be treated if found early. And this is really something around newborn screening that's been a really important and critical part of the March of Dimes' work for a number of years. So in today's panel discussion, we're going to be focusing on ways that expecting mothers and families can reduce the chances of delivering a baby with birth defects and improve those outcomes for them. Again, we want to make sure that everyone is clear. Not all birth defects are preventable, but we want to make sure at the March of Dimes that we're doing everything we can to make sure that parents feel supported, because of course all babies are blessings. So we're going to start the conversation. I just want to ask that if you want to join the conversation generally over the course of this month, that is National Birth Defects Awareness Month, you can join the conversation by using the hashtag across the lifespan on social media. You can also visit the March of Dimes' website at marchofdimes.org/birth defects. And also there's a ton of information at the CDC's website, cdc.gov/birth defects. So with that, we're going to kick off this conversation, and I'm so excited about our experts and our families that are going to be here, that are here today to share their experiences and their knowledge, which is so rich. I'm going to start by introducing first Dr. Amanda Cohn. Dr. Cohn is currently serving as the director of CDC's Division of Birth Defects and Infant Disorders. Dr. Cohn is a board certified pediatrician and is a fellow of the American Academy of Pediatrics. Dr. Sonia Rasmussen is the chair of the board of the National Birth Defects Prevention Network. As a pediatrician and a geneticist, she sees a broad range of adult and pediatric patients. Dr. Rasmussen joined the University of Florida in 2018 after spending 20 years at the CDC, where she worked in the CDC's National Center on Birth Defects and Development Disabilities. Those are our two medical experts, but we're also joined by what I call our family experts, because they have a lot of rich information to share about what it's like to be a parent of a baby, a child who has been affected by a birth defect. And I'm going to introduce those families now. The first is Richard Ingle. He is probably the most recognizable face on the screen right now. Richard is actually joining us from Kiev. So we're really grateful for him being able to join with the time difference that he's experiencing and all of the events around the world that are going on that we're very well aware of. Richard is one of America's leading foreign correspondents. He's known for his coverage of wars and revolutions and political transitions and all kinds of things, foreign relations related. He's been doing this for over 20 years. Richard is also the father of two boys, Henry and Theo. Henry was born with a rare genetic disorder that affects brain development, commonly known as Rett syndrome, R-E-T-T syndrome. And he's going to be sharing more about that momentarily. Next is Brandy and Derek Morris, and they are joining us from North Carolina. Tatum Lee was born with an extremely rare neural tube defect called frontal encephalocele. I'm going to make sure that I pronounce that correctly, which causes the brain to protrude through the front opening in the skull. And after recovering from multiple neurosurgeries, Tatum Lee is actually now a healthy and developing toddler. So we're really grateful for Brandy and Derek joining us. And then last, but certainly not least, we have Sarah Perez Fusona. Sarah is actually one of our members of our March of Dimes team. She is our Associate Director of Health Equity Training. She trains healthcare professionals on implicit bias and helping them recognize implicit bias as they treat various patients in their day-to-day lives. Sarah's son was born with Vacteral Association, a series of congenital malformations, which caused him to spend a month in the neonatal intensive care unit. Xavier underwent 9 major surgeries by the time he was 3 years old, and now he's a thriving 10-year-old. So we're going to be hearing more about Xavier. But again, I just want to thank all of you all for joining today and for sharing your expertise. And we'll get into the conversation. So we'll start with Dr. Rasmussen. If you could, thanks again for being with us. If you could just start with just explaining to our audience what birth defects are and going into a little bit more detail about it and what causes different types of birth defects. I think we talk about birth defects as if it's just one thing. As I introduce our families, you now heard there's 3 different forms of birth defects just represented on this call alone, and many, many more beyond those that we'll be talking about today. But give us just an overall sense of birth defects generally and some of the causes that we could start to learn about.
Yeah, as you said, birth defects is a broad term. It refers to any changes in the way that the body is formed or in the way it works that are present at birth. And it can, as you said before, affect any part of the body, the heart, the brain, the face, and can be mild or can be severe. There are many types, and you mentioned some of them, spina bifida, heart defects, cleft lip, and there are also genetic conditions such as Down syndrome that are included as birth defects. They can have effects on people for their life, or for some children, their birth defects, they can have surgery and they have less of an effect on their lives. But you're going to hear from many people, the effects are lifelong. The causes, we're starting to learn a lot more with the advances in genetics. We know a lot more about causes of birth defects. And sometimes we can identify a chromosome abnormality or a particular change in a gene, a particular misspelling in a gene that is the cause of a child's birth defect. There are also non-genetic causes, things like a virus, like Zika, or medications. Certain medications can increase risk of birth defects, or alcohol, or even maternal conditions like mom having diabetes and being under poor control with that diabetes can increase risk of birth defects. The biggest concern is in half the cases, about half the cases of birth defects, we don't know what the cause is. And that's why research into birth defects is so important.
It's so important. Let me ask you one other question. How is it, and we'll probably hear this in some of the stories that we hear today, but you know, if you're at an increased risk of birth defects, or how do you know that? And how does a pregnant person know that they may need to be extra aware of that? Is there any kind of way that families or pregnant people can even be aware of that, or maybe reduce the risk of a baby being affected by a birth defect?
One of the things that's helpful is to meet with your doctor before you get pregnant. And the doctor can then talk to you about your family history. Are there things in your family history that make them concerned about you having a baby with a birth defect in the future? Are there medical issues that you have? Like, are you on certain medications that might increase the risk of you having a baby with birth defect? Also, it's important, I mean, we all are hearing a lot about vaccinations, but vaccinations are important too. There are certain infections that if you get them during pregnancy, they can cause birth defects. And for those, it's important to get those vaccines before you get pregnant. And so seeing your doctor beforehand can really make a big difference in lowering your risk of having a baby with a health problem.
All right, we'll come back to that and talk some more about that. Thank you for that. I want to turn it to Richard, and Richard, again, thank you for joining. You've got a really compelling and in many ways heartwarming and also a heartbreaking story about your son Henry, who is affected by this very rare genetic mutation, Rett syndrome, that inhibits his ability to walk and talk and do many things. So we're also you know, lucky to have you on, sharing information around foreign affairs every single day, but we'd love to hear you talk about Henry and just tell a little bit about the story of your family and Henry.
Well, Henry's story is the most important story, most difficult story I've ever had to cover, I've ever had to live, I've ever had to experience. And we didn't know about it right away. So Henry was born and things looked normal. He looked healthy. He sounded great. He cried. He was a beautiful little baby. And we started to notice a little thing early on. He was weaker than other babies. He didn't feed well. He didn't nurse well. And that gave my wife, Mary, a lot of stress. She thought maybe it was her fault. She wasn't producing enough milk or she wasn't doing it correctly. He was our first child. And we got over those issues, had to give him food from a bottle. Initially, we had to even give him a food formula through a dropper because he wasn't swallowing it very much. So he was very fragile and very weak, but we weren't overly concerned. We took him home and eventually we did get enough formula and then later on milk, and he was starting to grow, and he rolled over and he sat up and he started to crawl, and he would do kind of an army crawl. So it wasn't exactly a high crawl. He kind of dragged his pelvis along, but he moved. So we weren't overly concerned. I thought maybe it was just a difficult arrival into the world. But then around 6 months, 7 months, he wasn't really progressing. Other babies were doing much more. So we would start going to play groups and having other children come around, or we'd go visit them. Suddenly they're doing lots more than he was. They were pulling up to stand, or they were walking, or they were verbalizing much more. And he really wasn't doing any of this. And by a year, we were deeply concerned because he still was at the same stage that he was at in those very initial few months. We couldn't really assess his intellectual engagement because he was still quite young, but we knew we could hear, we knew he could see, he would react to sound and to us. and he had a decent amount of mobility and hand use, those things would deteriorate over time. But we started running through tests, and the tests were simple, like hearing and eyesight and blood tests, and didn't seem like anything was wrong with him. All of his body parts worked. They just weren't really doing anything. And it was only until we did a full genetic test that we realized it was one of these typos in the genetic code. We are, all of us, long strings of genetic code. And sometimes that code gets misprinted. There's a typo in our genetic code. And the very long computer printout that we got showing his genetic code had exactly that spot. It was on a particular gene that I'd never heard of called MECP2. I know a lot about MECP2, MECP2, and there was a break, not a break, a malformation in this gene. And unfortunately, this gene is profoundly important for the body, for controlling our brain, for the brain's ability to control our lives. So it's almost like we're speaking on a computer. You know, you could have a problem with your computer that is a chip in the screen or one of the keys is missing. His problem was in the basic operating system of the computer itself. And that was obviously profoundly difficult for us to hear. You can't, at this stage in science, change that genetic code. It is a lifelong problem. And Henry is now 6, and his condition has gotten considerably worse in that he can't walk or speak or eat or feed himself, and we don't really know mentally what's going on. We know he recognizes us. He loves us. He loves affection. We love him. We try to communicate with him through cards, like a yes and no card. Sometimes it works, sometimes it doesn't. So it's very difficult for him, obviously, primarily, but it's also very difficult for us because it's just emotionally tough. Physically, it's tough. We have to carry him around. We have to feed him. We have to basically handle all of his bodily functions. And we know that unless there's a major breakthrough in science, this is going to be like this for a long time, because unlike a lot of these serious genetic disorders, Rett doesn't actually, well, let's just say it doesn't lead to, it's not fatal unto itself. A lot of the Rett children die from other issues. They choke on something, or they aspirate, or something else happens because their body is so fragile, but it itself is not lethal. So he could have a near normal lifespan. So that is also another factor that my wife and I have to think about, that it's possible that he could outlive us and require ever greater care. So it's also important to raise awareness, going back to what you're saying, to know what you're getting into about testing, because having a special needs child with this level of needs, it's a burden unlike I had ever expected. Now we're part of a community of other special needs families, and we share their experiences. It's very expensive, profoundly expensive. That's something that people need to get their head around. The testing is so important, because if you don't get tested and you don't get a diagnosis, well, it's very hard to get insurance. Because if you just have a child and they have big needs, but you don't have a piece of paper that says exactly what they have, it makes filling out your forms immensely difficult. So testing as early as possible, because if you're going to have if you have a child with profound special needs, you're going to need a lot of help, and the more help you can get early, and the more documentation you can have early, helps you helps you out a great deal. But anyway, I could talk about Henry for this entire hour, but I want to let some of the other wonderful families tell their stories. And obviously, if you have any questions, comments, I'm happy to talk.
Yeah, absolutely. And I just remind everybody, if you've got questions or anything you're curious about, please feel free to put those in the chat, and we'll be able to come back to you, Richard, and talk more about your experience for sure and your family. I do want to turn to Brandy and Derek Morris, though, right now, because you all have a very compelling story around Tatum, and would love to hear more about your story with Tatum Lee. I don't know if you prefer Tatum Lee. I kind of like that. It reminds me of my own Southern roots, where everybody's got two names, right? Anyway, please share your experience about her and your journey, and again, kind of where she is today.
Sure. If you want to get even more Southern with it, her nickname is Tater. So yeah. So we actually kind of found out about Tatum's diagnosis very late in pregnancy. We had actually had a normal anatomy scan, all normal blood work, and happened to decide to go for 4D photos just for one extra round. And went, and the technician got very quiet while she was looking and said, I think you need to go to your OB. I'm seeing a mass on her face. I don't know what it is, but don't panic. So of course we panicked. And then we kind of, I had some more imaging done with our OB, and then we had an MRI done, which confirmed that it was brain tissue that was protruding. So then it kind of switched to a high-risk pregnancy for the final weeks. She was born, and it was covered with flesh, which was one of the concerns of the neurosurgeon. If it was not, she was going to have to go on ahead and have surgery as a newborn. But thankfully it was covered, so she was able to just go home with us and grow for a couple of months. And her first neurosurgery was at 3 months old. So they did, they removed that extra non-functional frontal lobe, kind of did some reconstruction with bone, and then she came back home for a bit so we could get ready for her next surgery. Because she's had a neurosurgery, though, she is more prone to seizures. So we did have one very long hospital stay where she had a seizure that lasted close to 30 minutes, I think. So it was a very scary time then. And then she's on seizure preventative now. And then she had her second surgery in March of 2021, where they tried to do a little bit more reconstruction to kind of correct her orbitals, because they are not typical because of the brain protrusion, and do a little bit more reconstruction. We may be looking at one more surgery when she's 8 years old. They kind of want to see how she grows into it for now. But we're very fortunate, other than having to go through surgeries and whatnot. She's an incredible kid. She's, I think, a normal 4-year-old, learning and growing, and she keeps us busy, that's for sure. I don't know what else you have.
Yeah, Derek, I'd love to hear you share a little bit more about, especially as a dad, and Richard shared obviously his perspective as a father as well, but love to hear more about how this has impacted you and what you've been doing, or what advice you would give to other parents around, finding out this information about your baby, about your newborn. How do you deal with it, and what advice would you share with other families?
Yeah, I think, and Brandy touched on when Tatum had the seizure, that wasn't something we could prepare for. Whereas the two surgeries, we could reach out for resources and find information to kind of help us mentally ourselves prepare for the surgery. And I think the best, reach out to the right sources to find that can explain what's going to happen for you. But being prepared, the anxiety of the surgery we were able to kind of calm that a little bit. By far, the hardest thing we had to go through was the unanticipated seizure and week-long stay for that. So the more you can prepare yourself for going into these types of situations and learning about it from the right resources can definitely help.
Yeah, absolutely. And at the end of this, we'll share some other resources or places you can go for all kinds of help and assistance, and the websites of March of Dimes and CDC. provide a lot of this as well. I do want to come back to a point that you are raising, and I've heard now in the two stories we've heard, is there's so much focus on the baby, for obvious reasons, as there should be. But in that process, we can't lose sight of what you all as parents need to be supported, both physically, mentally, emotionally. That's a huge burden that is wears on all of you all, and I know it does. So we should probably come back and talk about that, because we can't ignore the families who are supporting their babies in this process, and the babies are relying on you all to be there for them, and it means you got to be strong in that process. So let's come back to that. Sierra, I want to turn to you. And thank you for being here. Thank you for doing all the work you do for the March Times, actually.
Love it.
I don't get a chance to say that, but let me take that opportunity. You have gone through a real process with Xavier, and actually before this call, you were sharing a little bit about it with us. But why don't you share it with the audience and those that are listening, and tell us what is Xavier's condition, and what's been his journey and your journey with him as well.
Okay, thanks, Stacy. Yeah, so my son is diagnosed with Bacterial Association, and it's an acronym, and it stands for vertebral, anal-atresia, cardiovascular, trachea, esophagus, renal, and limb. And so if a child is born with three or more defects in 3 or more regions, and everything genetic is ruled out, they're kind of lumped into Bacterial Association. And so the severity of these malformations, it just varies. And when I was pregnant with Xavier, the only thing I knew was that he was going to be born with a club left foot, because that could be seen on the sonogram. Everything else seemed, quote unquote normal. I was being monitored because at the time I was advanced maternal age. So I had a lot of non-stress tests going into it. And at one point in time, I did have to be placed on bed rest because my amniotic fluid seemed low. But again, it just seemed it could have been me working at the time. And so it wasn't until he was born where, he was born right at 37 weeks. So you have the, sort of like late preterm birth. Some people want it, right at 37 weeks. And there was a NICU team ready because they knew at least about his club foot. And it wasn't until I was able to see him and he was crying that the doctor, one of the neonatologists, leaned over and said, we have to examine your baby further because there are some issues here. And so, they took him away, and I wasn't able to see him for a few more hours. And I was able to be briefed on some of the obvious malformations, and one which was right off the bat was imperforate anus. So for example, he had cute little butt cheeks, but there was nothing in the middle. And so he was actually transferred over to a level 3 neonatal intensive care unit, where he had his first surgery at 3 days old to correct that, his first anorexoplasty, and it didn't seem successful. So at 5 days old, he had his second surgery for a double barrel colostomy, which he actually had for about 3 years, because in between that time, he had additional surgeries to try to correct other birth defects that he has. And so he is followed by just quite a number of specialists. So even though we had 9 surgeries, there were just umpteenth procedures and different offices, different phone numbers, different specialists, cardiology, neurology, urology, colorectal, on top of the pediatrician, and then ortho, and then physical therapy. And so luckily for his defects, a lot of them have been able to be corrected. They've been corrected, and right now it's just a lot of monitoring. I know we're going to kind of talk about it later to parents and families that are going through this. You just have to be okay with that ambiguity, with that not knowing what's going to happen. You can only operate in the here and now and focus on that, and just go with the follow through. Like, oh, time for a cardiology, but oh, it's time to go see the neurosurgeon, and just continuing with that. And Xavier, he's actually turning 10 and next month, so he's almost 10. He thinks he's 10. He wants to be 10. He wants to be double digits. But overall, he's doing great. And it was just one of those, like, it didn't know about it, now we do. And I'm just really thankful to be able to bring awareness to Bacterial Association and really appreciate this webinar today. So.
Yeah, it's very helpful. Dr. Cohn, I know you've now had a chance to hear all these stories. Thank you for being on today. How do you receive these stories? And like, what would you say to other families having heard these experiences? How do you talk to other families, preparing them for, trying to have the healthiest pregnancy possible? A lot of these outcomes were not even things that could be detected early or prevented at all. So how do you even talk to families about some of these outcomes and in any way possible, empower families as much as possible during pregnancy and then after as well?
Thanks, Stacy. Yes, I'm still really just in awe of all of you. So thank you, Richard and Brandy and Derek and Sarah. Those were incredible stories, and I think just demonstrate both the how each individual child is different, but also some of the similarities across families and what families and children experience with birth defects. It really drives what we do at CDC. It drives me as a pediatrician to prevent, to do research to try to prevent birth defects, but also to support families of children who have birth defects and empower them as best we can. So Sonia mentioned earlier, there are multiple different kinds of birth defects, and each type of birth defect will come with different symptoms and health problems. And so some of the treatments may involve surgery, as you've heard. Some will involve medication, early intervention, lots of therapy, both sometimes speech therapy, physical therapy, post-surgery types of therapy. And then sometimes there's not, while physical and occupational and speech therapy will help, there's some things that there are some birth defects, such as Richard's son, who, he will continue to deteriorate, unfortunately. And I think that in those cases, I think as Richard just described so beautifully, you just love that child and support your family and support your child with everything you can. And, so I think the important thing for families and what we want them to see is that you both stay connected to healthcare throughout the child's life. Some of these birth defects, they may thrive, and then later in life, they may have some unexpected consequences. And so it's really important that that child stay connected through, with healthcare ongoing. But it's also important for parents who have children who have young infants or are pregnant to know that if they think that there's a problem with their child, if they're concerned about the way they're feeding, the way they're playing, the way they're talking, please reach out to your healthcare provider. I think parents know their children best. And I know sometimes, it's really hard to differentiate what is, normal or, just a child being a little different versus, a sign of a serious problem. And so we do have a list of early intervention contacts. Early intervention is really key to supporting kids with birth defects. And we do have some information on our website we can share with you.
It was great. Please, Richard, go ahead.
I just would add one thing to that, and staying connected to the medical community is a must, because these kids are, at least Henry is very fragile, and kids who've had lots of surgeries, you never know exactly what's going to come in store. And Brandy, you said you're potentially facing another surgery. But I would also add that you can't do this alone. I'm fortunate enough that Mary, my wife, Henry's mother, is a full-time carer. So I'm here in Kiev right now, and I'm busy working, and who knows what's going to happen in this country. But she was at the hospital with Henry today, and she did a 2-night overnight study with him in the hospital, sleeping in the bed with him a few days ago, and she's going back in for another one in a few days, and that one's going to be for more monitoring, because he has a breathing machine that helps him breathe in the evening, and they have to calibrate it. And it's on a ward in a hospital. So you can't do this alone. And you need a partner, whether that partner is a spouse, whether a partner is a mother, whether a partner is a neighbor, is a friend, whoever it is. You've got to reach out and get help, because you're not going to be able to do it alone. And you can't isolate yourself. It can be very frightening out there in the world. I remember the first time I took Henry for a walk down the street in what was obviously a wheelchair. And the first, when babies are little, you can put them in a stroller, and nobody really notices. Then when he's too big for a stroller and you need to put it in a more structured seat, I remember feeling different. Oh, I'm the guy pushing a child down the street in a wheelchair. And a lot of families that I've seen are afraid to go back out into public. They're afraid of the looks that they get, sometimes just stares from children, stares from other parents, sometimes sympathetic, sometimes just stares. And you gotta just do it and embrace that's your life. That's the way it's going to be. And this is your child, and you need to love them as much and more than you ever thought you could, because they need it and they deserve it.
You know, I'm really struck by the uniqueness of each one of your stories, and kind of overwhelmed by what we know about these 3 different conditions, and of course the many, many others that exist beyond the ones we're hearing about today, but also the weight of what we don't know and how important research is, to better understand, are there things that we can know scientifically, medically, to help prevent these kinds of things from happening. I'm sure each one of the families have done enormous research independent on your own at 2:00 in the morning, probably reading up on things and trying to get as much information as possible. But Dr. Rasmussen, can I turn to you, and then maybe Dr. Cohn and others can chime in. Where is research on birth defects generally on, and you know, what's missing in the research that we need to focus on? How important is it to continue to expand the amount of resources that we are committing to researching all of these conditions and trying to help more families?
Yeah, I think there's 2 things, and both of them need a lot more research. One is trying to understand causes. And I mentioned before that half the time we can't figure out a cause. We do lots of genetic tests. I see kids in clinic and do lots of genetic tests. I do whole exome sequencing. I do everything I could possibly do, and I still can't figure out a cause. And that happens pretty frequently. But I think the other kind of research that's so important right now is to try to figure out how to make kids who's are affected by these conditions and their families' lives better. And there's just not enough research on that right now either. And I think we really need to try to figure out how to do that. Are there better ways to help Richard's son breathe at night than the CPAP machine that he doesn't like? You know, is there something else that can be done? And so many of the conditions are very rare. So the number of children with males with Rett syndrome is really rare. We need to be able to do as much research as we can to understand what can be expected in the future, and how can we make lives of kids with birth defects and genetic conditions and their families' lives better.
Are there opportunities to expand testing even before pregnancy to better identify the risk of any particular defect, or are we doing enough on that front?
Yeah, I think it's really important for families to see a physician before pregnancy, because there are things that can be we can know something about before pregnancy, or we can know you're on a medication that increases risk of you having a baby with a birth defect, and let's switch you to a different kind of seizure medication. So there are things to know beforehand. I do think, and this is one of the reasons why I think Birth Defects Awareness Month is so important, is I don't think most parents, when they get pregnant, and I hate to sound like a depressing person, but I don't think most parents realize that there's a 3% chance, a 1 in 33 chance of having a baby with a birth defect. And Doing everything you can to be healthy before pregnancy is important, but we can't, there are a number of birth defects we're not able to predict or prevent at this time.
Just add to Sonia's comments. I think that both research to understand birth defects and, as Dr. Rasmussen said, research to support families and parents are two of the main focuses of the work we're doing at CDC. And we've been running a very large, the largest in the nation, risk factor study for birth defects for many, many years. I think Sonia was involved much earlier on than I was. And with these very rare birth defects, we still don't, the power of a lot of research is incredibly challenging because these conditions are so rare. And I think there's going to be a lot of opportunities in the next coming years with using data and some of the ways that things that we're learning in part because of the COVID pandemic, new ways of looking at information that may help us identify some additional causes and prevention. So, I'm hopeful that we haven't, that we're not at a place where, that we will continue to, over time, identify more causes and find ways to prevent more than we do right now.
We have a question from Facebook, and this is the same question I was just going to tee back up. And I guess I'll start with Brandy and Derek on this, but then Sarah and Richard, you guys would chime in. The question is, as a bystander, what can we say by way of encouragement and compassion to families? How can we offer support? And I would just frame it also in general, like, can you be more specific about what kind of support you had to tap into as parents to kind of help you emotionally and psychologically even, and what can people do to better support parents through this process as you're dealing with a challenge with a newborn or a new baby?
I think trying to get, an understanding of what exactly your family member may be going through, just so that you recognize what the challenge is. I think one of the biggest supports we found was in a Facebook group for other parents with children with encephalocytosis, just because they all had been through it before and they were able to answer our questions where, our neurosurgeon had seen it before, but the pediatrician we were looking at had not, the OB that I was seeing had not, so there was very little resources for us as far as encephalocele beyond our neurosurgeon. What do you think?
Yeah, and not just to our specific birth defect, but other families that have gone through difficult times with kids that may have had Down syndrome or something like that. They were good support for the stuff that they've had to go through. Not that families that don't go through it can't be supportive as well, but they were able to help give us an understanding of what may be in our future and some of the things that we may go through.
Well, it depends. I'll take it from there if that's okay. As a bystander, so I'm reading the question, says, as a bystander, what can we say to encourage and compassion to offer, encourage and offer compassion to families? So if it's just somebody on the street, I'm not saying you don't really need to do anything. Just be kind and be normal, and don't, Henry is just a child who this is his life experience. So there's really nothing you can do, and it's not unusual to look. We're not invisible. When I'm walking down the street, or Mary's walking down the street and we have a wheelchair, yeah, that's the reality of it. You don't need to look away. You don't need to give us sympathy. It is what it is. But I would say, if you're not just a standby, passerby on the street, and you're a family member or you're a friend, then do something. Help out. It's really hard to have a special needs kid. So if that child is going in for surgery, help out. Offer to take the car back to their house because they're going to be at the hospital. Go clean their house if you want. Bake some cookies. Do something. Help out, because it's really tough.
Yeah, and just to add to that, Richard, I think you did a great way of saying, if it's a passerby, but definitely for me, for me, I definitely leaned on my family and friends. I'm a single divorced mom who works full time, and I was fortunate enough to have insurance the entire time. And so, you know, it was my friends, my family there during the surgeries, and they were my support. And I am so, so grateful for that because, but then sometimes the reality is there is nobody else that can do what you need to do at times. For example, when my son had to have what's called anal dilations, I'm not having anyone else do that to make sure that his newly created anus wouldn't close. It's not something, that kind of burden you don't put on other people. And it's not something I would have asked anyone to do, that I had to do for weeks to make sure that he could, poop like any other boy. And so, I mean, sometimes there's that reality. And so all you can give is that empathy and compassion and encouragement and support. And you know what? I will take a plate of cookies. So.
Yeah, I mean, a plate of cookies won't cure everything, but it certainly can help a lot of things. I would definitely agree. And Rich, I was just thinking, when you were talking about your wife having to spend the night, 2 nights in the hospital, who was at home taking care of your other child? I mean, these are real. It's not even one person that you need by your side. Sometimes you need a whole network and support system.
You need a network, and then a network to back up the network. And then everything gets messed up with COVID because people can't show up anymore. So your network gets totally disrupted. The carers who are supposed to come don't come, or they're trying to do physical therapy, will offer it via Zoom. You can't do physical therapy via Zoom. You need to be present in the room. You need to be hands-on. So yes, it takes an army, and an army takes rotations and reserves and deployments, and yeah, it wasn't made easier by this pandemic.
I also think that there's a real practical issue that I heard you raise, all of you, about the expense of it all. I mean, just to be very practical. I mean, obviously, you all would go to any length to make sure that your child had the resources that they need to support them and as much as possible. But the reality is it's very expensive. And can any of you talk about that? Like, what's the combination of insurance? Is it only private insurance? Do you get Medicaid support? Even, I mean, we know, for example, a lot of babies end up in the NICU. For parents who have private insurance, Medicaid actually sometimes picks up the expenses because those NICU stays can be very long. Tell me about the way you've been able to tap in a variety of resources that are available to you to help on this, or what kind of burden this is creating for your family, just from a financial perspective, just for everybody to put it in context. And
well,
Sarah,
luckily, Mary
Mary
robs banks, so that helps.
For living.
Yes, at night.
Time, right?
No, but it is, the therapies. It's also we're very fortunate to have insurance, and I've worked for a very big company, and so it's useful. But there are a lot of things that aren't covered. We do a lot of therapies, and you have to supplement the therapies that are covered by your insurance. And so I mean, we do, I don't know, 7 therapies a week for Henry, and from between physical therapy and occupational therapy, to try and keep him as strong, active, engaged as we possibly can, to keep his body moving, as we have to do everything for him. But insurance, it's just, I think it covers a couple a month, if that, is what the standard allotment would be. So you have to be prepared for that. So insurance is generally good if you have one incident. If you're in you break your leg in a car crash, your insurance is fine. But if you have a chronic situation that is going to last years and years, I think the current insurance system does not handle that very well. And sorry, I stepped on someone.
Oh, no, you're fine. Sarah, do you want to share how you're facing all of those challenges?
Sure. I mean, again, very fortunate enough to be working full time, and I was before I came to March and Dimes this past, in 2021, I was working with a healthcare system in an OB/GYN department, and so I had a lot of support, a lot of understanding, and again, just super grateful to have been in that position at that time. But yeah, the bills the contacts, keeping everything straight, it can be extremely overwhelming. And you can work with hospitals to, work with the billing departments, making sure that insurance is covering what they can cover up until a certain point in time. There are payment plans. I've had to go on different payment plans because my son had, for example, he had surgeries at in 3 different states at 3 different hospitals. So managing all the, contact information, medical records, billing departments, and then you've got bills from the hospitals, then you got bills from the specialists. And so if you have a way to organize those stacks of bills and explanation of benefits, and if you can't do it, then delegate it to someone else. That's another thing in terms of support system. If you can't do it, then delegate it to someone who's actually going to be there and wants to do the research or keep track of the bills or keep track of all the contact information. So it is definitely, you're definitely going to get to know a lot of different people. And, those contacts are so important. The registrar, billing, so important. Insurance contact, extremely important. And so at least for me, and again, I recognize my privilege in having that for my son. I've been able to manage that in that sense.
Brandy and Derek, did you guys want to add to that?
Yeah, just kind of piggyback on that. We were also very fortunate to have great insurance through all of the surgeries. After the last one, that neurosurgery didn't really want her back in daycare with a bunch of other 3 and 4-year-olds with new bone grafts on her skull. So I, was looking at keeping her home with me for a month, and thankfully I work from home, but that's also additional burden there. So we were also very fortunate in being able to have my mom come and keep her company so I could still work all day, to not have to take time off, to create additional financial burden. So there's lots of things that people don't even realize that you have to consider when you're going into a journey like this.
Yeah, absolutely. Dr. Cohn, I know we're just about out of time, but I'd like to ask you just to talk us through a little bit about what's available at CDC in your office of focusing on birth defects. What are some of the resources that families might be able to tap into if they find themselves experiencing a baby who's been impacted by a birth defect?
Sure, and I will say that we have resources that can help, but as you've just heard, I mean, the incredible complexity of managing your, each individual child has a different set of complexities, not just medically, but multiple hospitals and medicines and all of that. And so, it's still, these resources are more general. We do have, for example, resources on our web pages that can connect you with your state's early intervention programs and can help you get additional support in your state. We have a lot of information on birth defects and the research that's being done, and support ways for people individuals who are managing children with these birth defects know everything about them, but sometimes it's helpful to have information to share with others, and we have a lot of really useful information on our website. We always make sure that our research that is available is being published, and we're constantly trying to push the envelope on understanding birth defects better, and we will continue to do that. There's also right now a lot of information about managing with disabilities or birth defects during COVID, which I think is, as you all know, and Richard alluded to, it has just made everything more complicated. And I think the disruption that has occurred has been really challenging, and we know that many of these kids are at increased risk from COVID, and so may have more severe disease if they get COVID. And so information about getting your child vaccinated when they are at the right age where they can be vaccinated, information for moms about getting vaccinated against COVID and how to protect yourself and your children, but also just a lot of information that's tailored to families who are managing kids with chronic medical conditions or birth defects or disabilities in the setting of COVID, like how help that child get ways to support that child getting vaccinated, ways to ways to protect yourself, and access and accessible information to families. I don't know if Sonia has anything else to add.
No, that was great. That was great.
So just as we close out, we just have maybe a couple minutes. Are there any parting thoughts that you want to leave with anyone who's listening today about your experience, or any words of encouragement to another family that might be listening, or even policymakers? What would you want them to know about your experience, and what would you want them to be aware of, so that they're thinking about these things as they're doing the work of the American people, in Congress or state legislators or others as well? Richard, I'll start with you.
Well, I would just say to members of our tribe, to other special needs families, that they are not alone. It can feel very lonely because you see all the other families and their lives seem perfect, and they're going to the birthday parties, and they're going to the swimming pool, and they're playing in class and advancing in their normal grades. And your life is very different, and your movements are very different, and the expectation that you had and the life that you thought you were going to have, that you dreamt about having, is going to be different. But you're not alone. That life doesn't have to be bad. The life is just going to be different than you had potentially fantasized about. And you know what? It was probably going to be different anyway. It probably wasn't going to be as perfect as you had imagined it in your mind anyway.
Right. Life always throws us these curves.
Life always throws. And if you got to be resilient, you got to adapt, and you got to embrace the people around you who can help.
Absolutely. Sarah, any last parting thoughts? We just have about one more minute.
Sure. For the parents that are experiencing this, empower yourself, ask those questions, and keep on asking until you feel like you can wrap your head around whether it's diagnosis or definitions, procedures. You should be with a provider that's going to want to answer all your questions. And it's okay to get second opinions, but in the end, you're your own child's advocate, and and sometimes you're the only advocate. And so don't be afraid to speak up and speak out. And for providers who are working with families who maybe there's a language difference, etc., think about, in terms of empathy, think about what would you do if you were experiencing something in another country and without being able to communicate, and something this serious happens, and to maintain that empathy and compassion when you're working with your patients and families.
Great. That's a great point. Brandy and Derek, just about 15 seconds. Sorry.
Well, I think with everything we've talked about, it for those who may not be parents yet, it can be kind of stressful. Think about this, maybe a possibility of a road you'll go down, but there's no love greater than that that you have for a child. And I wouldn't trade anything that we've had to go through for Tatum. She's the best part of every day.
Absolutely. I
Hear,
think
hear.
that's a great
Well
parting
said.
thought. Thank you. Well, listen, thank you all so much. This has been awesome. And I hope that this has been helpful and beneficial to others. I'm really grateful for all of our panelists for joining today and for sharing all of your expertise and your experiences. We hope we've been able to answer some of your questions today. Again, if you want more information, you can go to marchadimes.org/birth defects to learn more. I also want to say one of the big things that we've still got to fight for in Congress is that the Newborn Screening Saves Lives Reauthorization Act is still pending. It has not been reauthorized. And we have been working hard to get Congress to take action on this, to support legislation, the passing of the Newborn Screening Saves Lives Reauthorization Act, that this is a high priority. As you've heard, screening for all kinds of health conditions at the time of birth is critical. And we've got to continue to make sure that this bill gets reauthorized to help save more lives, improve the health of newborns. So if you want more information on that, please go to marchadimes.org too. We'd love to ask you to join us as an advocate to advocate to Congress to make sure that they take action on this. Here are some other resources that are here. I hope that you take this down. In addition to CDC and March Dimes resources, there are a number of different websites that offer support to families facing birth defects. And the last thing I just want to say, again, if you want to engage in this conversation, use the hashtag across the lifespan. And the real last thing I want to say is that we're very, very grateful to Cigna for helping us to present this webinar today and for supporting our work around birth defects. So thank you for joining us today. It's great to see you all. And again, thanks to all of our panelists for a fantastic conversation, and take care.
Thanks for
Thank
having
you.
us. Bye-bye.
Thank you.
Thank you.
Thank you.